High blood pressure is often called the silent killer because it can damage the body without any noticeable symptoms until it's too late. According to the Centers for Disease Control and Prevention, 1 in 5 Americans with hypertension is unaware of their condition. This makes it even more dangerous as it's only a matter of time before it leads to serious health issues like heart attacks and strokes. That's why it's crucial to regularly monitor your blood pressure. But did you know that while checking your blood pressure is important, getting an accurate reading is quite a different matter? Yes, that's because various factors can interfere with your blood pressure measurement. In this video, we'll share 6 essential tips to help you achieve a precise reading and avoid common habits that can interfere with it. Stick with us until the end. One of these tips might make a significant difference in how you track and manage your health. 1. White coat hypertension. Ever notice how just being in a doctor's office makes your heart race? That's white coat hypertension at work. It's not unusual. Many people experience elevated readings just from the stress of the clinical setting. But this doesn't mean you're doomed to inaccurate results. Trust me, the trick is to replicate a relaxed environment when you're getting your blood pressure checked. Setting up your space with some comforting elements can help. Dim the lights, find a comfortable chair, and play some relaxing music if you like. Try to breathe deeply and slowly, focusing on calming your body and mind. This approach helps reduce the anxiety that might otherwise spike your blood pressure, giving you a reading that reflects your true blood pressure. Moreover, inform your healthcare provider about your tendency to experience white coat hypertension. They might consider taking multiple readings during your visit, allowing you some time to relax between measurements. In some cases, they might suggest wearing an ambulatory blood pressure monitor, which tracks your blood pressure over 24 hours. This would help provide a more comprehensive picture of your blood pressure throughout the day. 2. Patient behavior and preparation. What you do before taking your blood pressure matters a lot. It's like preparing for a workout. You wouldn't jump straight in without a warm-up, right? Similarly, a little prep can make all the difference here. First off, avoid caffeine and smoking. Both can elevate your blood pressure temporarily, so it's best to avoid them for at least 30 minutes before measuring. Think of this time as a mini detox for your system. Also, if you've been moving around a lot, take a break and rest for a few minutes. Your body needs to be in a calm state to get a true baseline. When you're ready, sit in a comfortable chair with your feet flat on the floor. Make sure your back is supported and your arm is at heart level. This position is crucial for accuracy. It's all about setting up the right conditions so your reading isn't influenced by external factors. Additionally, make sure to empty your bladder before taking a reading. A full bladder can increase your blood pressure slightly. It's also advisable to wear loose clothing so the cuff can be placed directly on your arm without any interference. By following these steps, you can ensure that your readings are as accurate as possible. 3. Observer bias and technique. Believe it or not, how you take your blood pressure can influence your results. It's a bit like following a recipe. Missing a step can lead to a different outcome. Let's talk about some common mistakes and how to avoid them. First, make sure your cuff is the right size. A cuff that's too tight or too loose can throw off your reading. It should fit comfortably around your bare upper arm, just above the elbow. If you're using a digital monitor, follow the instructions carefully to ensure everything is set up correctly. Another key point is to avoid talking or moving during the measurement. Both can impact the results. Stay still and silent for the short time it takes to get your reading. And don't forget to take multiple readings, about a minute apart, and then average them. This approach helps account for any anomalies and gives you a more reliable picture of your blood pressure. Be mindful of the arm you use for measurement as well. It's generally recommended to use the same arm each time to ensure consistency. The left arm is often preferred because it's closer to the heart. Also, ensure the cuff is placed at the correct height, directly at heart level. Incorrect positioning can lead to readings that are too high or too low. Enjoying the video? Be sure to give it a thumbs up, leave a comment, and subscribe to the channel. 4. Emotional state and stress. Stress is a sneaky culprit when it comes to blood pressure. Even if you don't feel stressed, your body might be holding tension that affects your reading. That's why it's important to check in with yourself before measuring. Consider doing a quick relaxation exercise. This could be as simple as taking a few deep breaths, doing a short meditation, or even just closing your eyes and picturing a beautiful scene. Making this a part of your routine can transform blood pressure checks from a chore into a moment of self-care. But here's something you should know. Keeping your emotional state in check isn't just good for your blood pressure, it's great for your overall well-being. It helps ensure that your reading is about your health, not just your stress levels. You should also consider the timing of your measurements. Taking your blood pressure at a consistent time each day can help reduce variability. Morning measurements are often preferred because they can be taken before the stress of the day begins. 5. Communication and patient-provider interaction. Good communication with your healthcare provider is key to managing your blood pressure effectively. As mentioned earlier, it's not just about numbers on a screen, it's about understanding what those numbers mean for your health. Keep a log of your readings, noting the time, date, and any unusual circumstances. This record provides context and helps your doctor see patterns over time. If something seems off or if you're unsure about your results, don't hesitate to reach out for guidance. Your provider is there to help interpret the data and offer insights. Having open and honest conversations with your doctor can lead to better health outcomes. They can suggest changes to your routine or treatment plan based on the comprehensive information you provide. Your log should also include notes on your diet, physical activity, and emotional state. This additional information can help your healthcare provider identify lifestyle factors that might be influencing your blood pressure. Furthermore, ask questions about your readings and what they mean. Understanding the details of your blood pressure results can help you make more informed decisions about your health. If your blood pressure is high, your provider may recommend specific lifestyle changes or medications to manage it effectively. 6. Impact of cognitive load. We live in a busy world, and our minds are often overloaded with tasks and stressors. This cognitive load can unknowingly affect your blood pressure readings, so before you check your numbers, try to clear your mind. Reducing mental distractions helps ensure that your blood pressure reading reflects your true health status. Engage in activities that help you focus and relax your mind. This might be a brief mindfulness exercise, some light reading, or simply sitting quietly and breathing deeply. Remember, managing cognitive load isn't just about the moments before you take a reading. It's about creating a lifestyle that reduces overall stress. Regular exercise, a balanced diet, adequate sleep, and mindfulness practices can all contribute to a healthier mental state. When your mind is less burdened, your body follows suit, leading to more accurate blood pressure readings. Additionally, consider scheduling your blood pressure checks at times when you are less likely to be distracted or stressed. Early mornings or late evenings, when the hustle and bustle of the day is at a minimum, can be ideal times. By doing all of these, you can ensure your readings are a true reflection of your cardiovascular health. Which of these tips will you try today? Let us know in the comments below. Thank you for watching. Don't forget to like, subscribe, and share your feedback in the comments section below. Be sure to check these videos.